Welcome.
Welcome.
Welcome to
Welcome. We have your thriving tips.
Welcome to Trips to Thrive.
Trips to thrive. I like that. Welcome. Tips to thrive. So, do you bring a best friend to a blind date?
Usually not.
So usually your blind date's alone.
I mean, it kind of was, with you.
So when you walk into
Well, it
a room
wasn't a
to
blind
see
date,
a
was it?
patient for the first time, do you have a student with you? Do you have a fellow? Or is it like an intimate experience?
So I usually always have a medical assistant. I do not allow fellows or residents join me if it's a first-time patient.
Why?
Because I am also trying to establish rapport in a relationship. So just like going to a blind date with, a friend, I don't bring my friend, but I do have to consider the setting that I'm in, which is professional. So I do have my medical assistant to be there to document the conversation.
Is there ever a time period when you go in alone with the patient?
I try to avoid being alone with the patient unless they are an established patient that might even be a personal friend, and I can trust that, they're maybe just sharing something more of a personal thing with me, not anything related to their medical care.
And what if they want to bring in like their husband, wife, best friend into the
Because this is not a social hour, we generally do not allow people to bring in family members, spouses, unless they're caring maybe for their child and they don't have, care at home. Otherwise, they don't bring any adults with them in that visit because it becomes more of a social hour.
Okay, so I'm going to give the 3 tips for when you are seeing a patient for the first time. This is a consultation first time. You don't bring your best friend to a blind date, so try not to bring other people into the room. You say you don't bring in family members. I'm okay with family members as long as they're not obstructive or causing problems. But you don't bring in fellows or residents. I don't bring in fellows or residents either to a first-time appointment because it does take away some of the intimacy, some of the rapport. I think that's right. Number 3, if you're going to be with that patient alone, especially if you're going to touch that patient in physical exam, have a medical assistant with you or another office member because you need someone to document it.
Agreed?
So, do you like the virtual date?
I don't, but maybe I'm old-fashioned.
Well, during COVID, there was all these people having virtual dates.
I mean, I think you would know all about it.
Okay, well, so when it comes to your patients, do you do virtual consults?
During COVID, we were sensitive to the fact that many people weren't going out, weren't comfortable. So we had very limited room in our reception area or waiting area. So because of that, we did do virtual consults.
Are you still doing them?
I am no longer doing that, and one at a time, all of my other associates in the clinic, there's 7 of us, now we're only down to 2 that are doing them.
Okay, do you see any benefits in virtual consults?
I think in the beginning there was a place for it, especially if people were flying in from out of state, to maybe do a larger laser resurfacing or lipo procedure. But what we found was that towards the end, it was actually becoming more of a time suck, and many of the people that we were taking on for virtual consult, even though they were paying the $250, never ended up coming in.
So you didn't get a good conversion rate on those people?
Not compared to the people that were coming in.
Okay, I think that a little bit different. My experience has been virtual consults have been very successful. We can screen patients out that we don't really want to see. We're able to accept patients from all around the country who then meet us first and hopefully come in afterwards. And we have a pretty good conversion rate. So
But
it's
patients
workable
are
for us.
also, your patients are, you're more of a surgical practice. I'm more of a non-invasive, same-day cosmetic practice.
Okay, so let's give 3 tips for virtual consults. I'm going to say yes, virtual consults, and maybe more if you're a surgical physician. It might make more sense for a surgical physician, but I think it's a great way to screen, and we know body dysmorphic disorder is very common in surgical patients, especially rhinoplasty patients, so good. Number 2 tip with virtual consults, if you're going to do it, you have to have someone good at selling or being able to convert that patient because it's very difficult to get them in case they're price shopping, right? And number 3...
Do you charge?
Yes, we do charge for a virtual consultation. The number 3 tip on virtual consults, I think, would be it saves time.
That's one way to look at it, but for us, it does not save time because it takes up 15 minutes of our time to do the consult when that time could be applied towards the 90% conversion rate we have for people that do come into the office and then elect to do a procedure.
There are some people, though, who schedule their days for virtual consults so they can be much more efficient. And there are also people who do it from home.
Yes, so I do have an associate that only schedules her virtual consult at the very beginning of her day and then at the very beginning of her afternoon immediately after lunch in order for that not to interfere with the flow of her clinic.
So tip number 3, if you're going to do virtual consults, make it fit into your schedule so it's most time efficient.
So can you tell me how much does Dr. Diane charge if I want to get my lips done?
No, we do not give prices over the phone.
Well, why?
you have to come in because we have a range of prices.
But I'm driving so far. It's like I'm so busy. I'm not available.
Right. You're just shopping me like you're shopping everyone else.
That is not true. I love Dr. Diane's work. I see it all over social media.
Okay.
I mean, there is no one else I would ever want to go to.
I hear this all the time. We get people who call us and they try to price shop us. My general theory to my staff is do not give prices over the phone. How about you?
I agree. We don't give prices over the phone. It's not about the price of a syringe. It's about the price of the final result. And that's really going to take an assessment to be able to get to.
Also, does your front desk person know exactly what the patient is needing?
Right, because the person might think that what they need is lip filler, but what they really need is perioral support, whether it's piriform injection or whether it's supporting the DAO.
So after the patient comes in and you see them, and who gives them the price? Do you do it or someone else?
So my medical assistants always give the price, and when they do it after I have left the room. Even if a patient is being pushy, like I was to your front desk staff on that little skit, I do not. I tell them that I don't manage pricing. My medical assistant does.
So to take you out of the negotiation process, so you're still the professional, you're not the bargainer.
Exactly. And then we don't bargain, we don't offer discounts. My medical assistant just prints it out in a quote and then provides that quote.
Do they sign it?
They sign the quote once they actually move forward with the treatment. But the quote clearly states that that price is only applicable for the next 3 months.
Okay, so the 3 tips here on prices. One is we're both going to say, don't give out prices.
Over the phone, because it may not be what they need.
Number 2 is have someone else give the prices, not you, because it keeps you out of that position. You're a doctor-patient relationship. You don't want to be necessarily the person doing the financing. And the third one is print it and have them sign it so the clear communication.
Absolutely.
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.